The Irish Hospice Foundation, with the Department of Health, conducted research into needs in the community for children in particular. And at any time, there are 1,300 children who have life-threatening illnesses right around the country. And the services available to them are virtually, now not completely, but virtually nil. Most people who have children with life-threatening illnesses would prefer that they should be nursed and cared for at home. And for this, they need palliative nursing care available to them in the community. After the needs assessment was completed, the Irish Hospice Foundation had a meeting with the Minister for Health and Children, Mary Harney, and it was agreed that in partnership, over 5 years, we could roll out a good service right around the country. And arising from that, a 4-point programme was agreed. Number one among those was the appointment of a paediatric palliative care consultant to give clinical leadership. And the next point would be to appoint 8 outreach nurses who would be available to all families once a child was discharged from the hospital back into the home. The third part would involve a training programme for community nurses and for paediatric nurses in the speciality of paediatric palliative care. And then the fourth point would be to establish a database of all children in the country with life-threatening diseases so that nobody can fall through the cracks. Claire Quinn, who lives near Ennis in County Clare, although a nurse herself, faced great challenges when caring for her own child, Olivia, after she was diagnosed with a life-threatening illness.
Our child was diagnosed with a severe disability at a very young age, but she had no diagnosis, our little girl Olivia. The last year, especially the last 6 months of her life, were extremely challenging. Really, she needed 24-hour care. She had severe seizures. She would vomit constantly, and her chest would fill up with phlegm, and she would be very distressed. We have 2 other children as well, so it was very distressing for them. We really needed help, whether it was practically with chores and things in the house. I suppose I was lucky in the fact that I was a nurse, and I was always on the internet reading, and I learnt how to cope with her myself, but I wouldn't have had a disability background or a paediatric background, so it was very daunting for us as a family. We really needed assistance here managing her condition for the last 2 years of her life. The lack of knowledge that we experienced from lots of different healthcare professionals was, I suppose, shocking. Really, you have to go knocking on doors, and actually most of the information that I received were from other parents in similar conditions, which should not be the way to go. When we recognised that she was very much end of life, she needed skilled palliative care, and I will forever be grateful to 2 nursing friends of mine who looked after her, that had that wonderful skills in end-of-life management. We also made the decision not to have her die in hospital, but we wanted her place to be at home, and we could only do that with the help from my nursing colleagues who managed her symptoms very well, and she had a beautiful death at home. So if anybody was to lose a child, which was and is unbearable, her death was beautiful at home because she was cared for so well by skilled practitioners, really. I think there's a huge need for somebody to coordinate the management of end-of-life care for a child. At this time, there needs to be recognition that the child is end-of-life, that it's not just an illness, but this actually needs a directive now that there is end-of-life management needed. And to have an outreach nurse that will coordinate the people that are needed, the various skills that need to be on board, whether they're home help or skilled nursing care, that needs to be managed. And I would see the role of the outreach nurse in managing all of that.
I'm the first outreach nurse for children with life-limited conditions. There's going to be one of eight posts throughout the country. I'm based in Temple Street Children's Hospital in Dublin. A lot of my work will actually be based, though, in the community. The role, I suppose, is to provide support for the children and families that do have a life-limited condition be it over the first few days when they're diagnosed with their illness, right through to living with their condition, and maybe then towards a terminal care and palliative care at the end of life stage. We'd come across children, newborn babies that may have heart defects, or may come across teenagers with cystic fibrosis or muscular dystrophy, a lot of children with neurological disorders. These families need a lot of support in coordinating the care they get from all the different professionals. This may range from making sure they get the same hospital appointments on the same day, through to maybe pain control and symptom management at end of life, through to even bereavement support after they die. The idea is you look at them through the initial stages of diagnosis, to them actually dealing with and living with this condition right through to their end of life. I suppose with children, it's not just the traditional view of palliative care, terminal care. This is a more encompassing package we'd like to provide.
We've agreed with the Department of Health to co-fund this comprehensive national community-based programme for children with life-threatening illnesses. And at the end of 5 years, we hope to have in place a very sustainable support structure for all these families, with outreach nurses, trained public health nurses, trained in palliative care, and paediatric nurses who are very aware of the needs of these children, led by a consultant.